Welcome back to the Better Health Now podcast. Today we have a familiar face back on the podcast, Dr. Lance Justice, an OB-GYN here at Cullman Regional. For those that maybe haven't listened to your previous episode, tell us a little bit about yourself and your background.
So I'm Dr. Justice, originally from Scottsboro. I've been in practice, counting residency, 17 years. Been here at Cullman Regional for over a year now. So
Wow,
I think
yeah.
the last time we spoke, I'd started about a month previously.
Yeah, so it's been you're closing out your first year, I guess, or coming up on your first year.
Yeah, a little past.
Just a
Yep.
little bit past your first year. So a lot of new and exciting things that you've been able to be a part of here at Cullman Regional. Today's topic of conversation in women's health is, and particularly GYN surgery, is the robotic GYN surgery. Talk a little bit about how this works.
Robotic GYN, especially with Da Vinci, is a game changer. So it came to market in 99, got FDA approval in 2000, and it completely changes the game when it comes to not just gynecological surgery, but general surgery as well. So it kind of levels the playing field. So we used to do, when it comes to hysterectomies, we used to do either vaginal or abdominal approach. Most hysterectomies were performed abdominal approach. Then we kind of transitioned into laparoscopic approach. And then when the robot came on the field, it changed the game because it made everything an even playing field. So body habitus didn't matter as much. Large BMI did not matter as much. So those cases that we typically would open someone's belly up, we can now offer those patients a minimally invasive approach.
Wow. And so this is something, did you have much experience to this prior to coming to Cullman Regional, or like throughout medical school? Or when did you first kind of get introduced for your field, particularly with the robotic?
So when I was in residency, we worked a lot with the robots and did some robotic training. But unfortunately, the hospital that I was at after residency did not afford me the opportunity to have the robot. So there was a lot of laparoscopic procedures, vaginal procedures, as well as abdominal procedures.
Gotcha.
So one of the things that drew me here to Cullman Regional was the state-of-the-art care that we afford our patients here. So when a patient comes to you, you can offer them those same advanced techniques here, where previously they would have to drive to the larger cities like Birmingham or Huntsville.
Wow. So what type of, you mentioned a little bit earlier, but what type of GYN surgeries are most commonly are done on the Da Vinci robot? And is that the same, the most common surgeries, the ones that you do yourself, or is there a little different for here at Cullman?
So when it comes to gynecological procedures, hysterectomies, so we do with the Da Vinci, removal of ovaries, oophorectomies, we do with the Da Vinci, taking out the tube, both tubes, we can do with Da Vinci. Ectopic pregnancies we can do, as well as endometriosis or just diagnostic laparoscopy. So we're really not limited. Anything we used to do, and even more with a laparoscope, we can now do with a Da Vinci. Here's a crazy statistic. So in Alabama, 80% of GYN procedures now are performed with Da Vinci robot.
Wow.
That's staggering. If you crunch that down, so since just in the past year, 2024, so there has been 2.7 million Da Vinci procedures performed. 2.7 million. Since Da Vinci came on the market, so over 17 million.
Wow.
Numbers have been performed with a Da Vinci.
Yeah, and so does that 80% for the state as a whole? Is that higher than most states that use it, or is Alabama in the top 5 of states with the most Da Vinci surgeries done?
Yeah, I'm not sure where we rank amongst other states, but Da Vinci's kind of the standard of care now when it comes to GYN surgery.
So for the process for a patient that's going in to have a surgery using the Da Vinci robot, is that process for them in the prep for that different than what maybe a traditional surgery approach would be?
So one of the things you have to take into consideration is what advantage does minimally invasive surgery have for the patient? So when you look at the overall cost, length of stay, patient satisfaction rate, one of the things that sets Da Vinci apart from traditional surgery is length of stay. Patients typically go home anywhere from 6 to 8 hours after a hysterectomy.
Wow.
That's unheard of because we were typically keeping patients for abdominal hysterectomy 2 to 3 days. Laparoscopic hysterectomies, we would keep them usually a day.
Wow.
So length of stay is big. What women would always fear when it comes to hysterectomy is the time off work. Most people don't have 6 weeks they can plan to have a surgery and take off work. So now it affords them the opportunity to have their surgery, be able to go back to work sooner, and get back to their regular life.
Mm.
And then you take into account pain control. Pain control is superb when it comes to the Da Vinci robot. So, because the way the arms work, they articulate inside the patient, so there's no torquing on the skin.
Mm.
So, when you don't have that torquing on the skin, that results in decreased pain for the patient.
Wow. Yeah, and it's incredible to see that time of recovery shorten that much with the
Mhm.
with the process of the Da Vinci robot. For technology like that, the Da Vinci robot is probably a pretty expensive form or just equipment itself for Cullman Regional. What is the cost of a Da Vinci system?
So, the Da Vinci system runs about $2 million.
Mm.
So, if you put that in perspective, as far as decreased length of stay, so increased recovery, increase back to the workforce. The cost is actually cheaper to undergo a
Mm.
procedure with Da Vinci. If you look at total savings over an abdominal hysterectomy, you're looking at a $15,000 savings.
Wow.
And compared to laparoscopic, you're looking at $8,000 savings. So if you look overall, so it's actually cheaper for the Da Vinci robot to
Wow.
undergo a surgical procedure.
Yeah. And so for Cullman Regional specifically, is it one Da Vinci robot for your area of expertise, or does it vary across the different uses that the Da Vinci robot can have? Because I think we've talked with some other doctors about just some other surgeries that they do with the Da Vinci as
Mhm.
well.
It's multimodal, so we have one robot here, and we can use it across specialty.
Mm.
One of the things that makes Cullman Regional unique is that we have 24/7 access to it. So, someone comes in the middle of the night with a ruptured ectopic pregnancy, so we can provide the care that we need
Mm.
24/7 and be able to perform that surgery with a robot as compared to previously where you had to do that laparoscopically. And one thing I'd like to clarify, because I get this all the time with patients, is they're a little bit nervous about having a robot do the surgery. And it's a misconception.
Mm.
The surgeon still does the surgery. So the robot is just a tool. The
Mhm.
instruments that go in the robot articulate. So I can move my hand around, you know, not completely 360 degrees around, but with a robot with those surgical instruments, the articulation is very finesse
Mm.
and it's very, very fine tuned.
Yeah, so it's I think I feel like probably from the misconception too is that if they get a surgery done with a Da Vinci, you're not even there. It's just the robot doing it, and that's
Right,
not the
right.
case.
That's totally not the case.
You're there. You're performing the surgery. You're just using that tool to help the advancements of that surgery.
Right, right. And it's something exciting that we have here in Coleman. So I mentioned earlier, so Da Vinci got FDA approval and then came to market roughly 2000. So that's 25 years. There's over 40,000 peer-reviewed articles on the Da
Mm.
Vinci. So doing the math, that's roughly 1,600 peer-reviewed articles a year. Divide that down even further, that's 4 to 5 peer-reviewed articles per day
Wow.
on the Da Vinci. The XI system, which we have here, it's been around for several years now, at least 15 to 20 years, and they've already changed up the technology 5 years. So the
Mm.
ability to operate on someone and have that 3D perspective, it was just like you're doing abdominal hyst, and you can three-dimensional view is phenomenal.
Mm. So in your area with the GYN surgeries, how often are you performing a Da Vinci surgery on a say weekly or monthly basis?
So currently, roughly 5 to 8 times a month. So, and that's just tip of the iceberg. So
Mm.
I've kind of constrained because of my clinic. So, trying to get patients in the clinic and get them taken care of.
Mm.
So there's a lot more out there that I need to schedule. It's just getting the time in
Yeah.
there.
And
But
so
that's a good problem to have.
yeah, oh, for sure.
Mhm.
So we talked a little bit about the cost, and with these such a high cost, not every hospital is able to obviously afford them, afford the robotic surgery. Like you talked about that
Mhm.
where you did your residency, you didn't really have that opportunity to use it. What and we've highlighted a little bit of this, but what advice would you give for people that are considering the robotic? And we've talked a lot about it already, but there is such a misconception and a misunderstanding and all of that goes along with having a robot do a surgery, but it's not really just the
Mhm.
robot, it's you with the robot versus a traditional, hey, my parents did something like this. I don't know about doing a surgery via a robot.
Mhm. Well, it's one thing, so we can talk about the advancements in technology, the benefit. So it all comes down to what's best for the patient.
Mm.
And upon having those informed consents with the patient, so regardless of which community you're in, if you look at the Da Vinci as far as length of stay, recovery, just look at outcomes, it's a no-brainer what is going to benefit the patient. But it ultimately comes down to the patient and physician and making that informed decision.
Yeah, and not every case is the same, and what works for one patient is not what's going to work for the other. And having that collaborative nature of having other doctors in with the patient that maybe, hey, they have a history of this or whatever it might be, it might help lean the patient towards a direction that's best fit for them.
Oh, 100%. And the Da Vinci, one of the things is the patient that I would in the past would have had to do an abdominal hysterectomy, and cause that patient to be here 2 to 3 days because you have to open someone's belly. Da Vinci affords that opportunity where it can even be a day surgery now.
Wow.
They don't have to stay overnight. They don't have to have that big incision on their belly. If you're looking at cosmesis, you're looking at scars, you can have 3 to 4 tiny scars as opposed to a large incision.
Wow. And I appreciate you being here today. I feel like this is incredible to think that this is a surgery that's had this much impact and not a ton of, not a long time. I mean, it's only been around since 1999, 25 years, and it's already had such an impact. Continues to seem like it's having a huge impact here at Cullman Regional. It's exciting just to see that continued growth, and it's exciting to have you back on. But I'll be sure to have everything in the episode notes if you want to find out more information about anything that we talked about. But I appreciate you being here today.
Sounds good. Thank you. Thanks for having me.